Alright, so I'm kind of leaving my job and I'm taking the last student that I'm going to have in the community setting. And I thought it'd be interesting to show you guys what my syllabus looks like. I'm an APPE preceptor, which is basically a teacher. They take students in their last year of pharmacy school. So we had to do 10 months or 10 blocks, 10 rotations of 4 weeks, each 160 hours. So that's 40-hour work week. This is unpaid, of course, it's a rotation. APPE stands for Advanced Pharmacy Practice Experience. We also have IPPEs, which are like introductory. It's scattered throughout the school year. So my course has its own little course number, it's 4 credit hours. Course description. The community practice rotation provides the PharmD student the opportunity to participate in the care of patients with a variety of acute and chronic conditions. This pharmacy location is a fast-paced environment with patients from a wide array of backgrounds, including many minorities and underserved populations. Many patients require careful attention and understanding. The role of a community pharmacist is extensive, as they are the most accessible healthcare provider / medical resource for the general public. These were the objectives. These are some more objectives. And these were my student activities. Accurately obtain verbal prescriptions, clarify inaccurate prescriptions and recommend alternative therapies to providers when necessary, review and resolve patient insurance problems, understand the entire dispensing process from order entry to verification, transfer prescriptions in and out of the pharmacy, demonstrate the ability to make a compound, participate in inventory management duties completed by the pharmacist as needed, provide counseling to patients on medications, devices, dosage forms, including but not limited to insulin, antibiotics, opiates, warfarin, enoxaparin, Eliquis, and continuous glucose monitors, recommend over-the-counter products to patients and caregivers, including but not limited to constipation, diarrhea, heartburn, allergic rhinitis, atopic dermatitis, cough and cold, and antifungal products, recommend a pediatric dose for a parent or caregiver for an over-the-counter product, demonstrate the ability to recommend and administer immunizations via standing order, recognize the red flags with regard to controlled substance prescriptions and become comfortable with using Inspect. This is our prescription drug monitoring program. If applicable, at the request of a patient, take a blood pressure and explain what that means in patient-friendly language, understand the difference between pharmacy law, policy, and professional judgment, complete a medication error report, consult a Medicaid formulary from in.gov website and recommend a covered alternative to a provider, and identify high-risk patients on opioids, calculate morphine milliequivalents, and offer naloxone by standing order with appropriate counseling. These are my little projects that I give them. I want them to complete one mini drug monograph. This is an example of actually a full monograph I did on viloxazine or Qelbree. So in a monograph we have like a product overview, summary, disease state strategy. I looked at comparison with other agents. In this case, Strattera or atomoxetine. It includes pharmacokinetics, indications, clinical evidence like clinical trials, a couple studies that I looked at. This is actually the side effect profile for Strattera for reference. We looked at drug interactions, dosing and administration, pregnancy, lactation, and then of course my references. I'll usually have them just pick a medication that's newer on the market that they want to learn more about.